Heart disease is the #1 cause of death in the United States. The National Heart, Lung, and Blood Institute, the NHLBI, which provides leadership for a national program in disease of the heart, blood vessels, lung and blood resources, and sleep disorders, funded this project to help African Americans prevent heart disease. This web-based training session, being conducted by the project team at Morehouse School of Medicine, will help community health workers, CHWs, like you learn the risk factors for heart disease so that you can help to educate other community health workers and clients. I am also encouraging you to participate with other community health workers in the online discussion forums that will be available in the virtual classroom as well. There are a total of 10 web-based sessions that you will cover during this training. If you are also participating in the Learning Circle discussions, these sessions will be taught in more detail in the classroom. The sessions are Knowledge is Power, Know Your Risk of Heart Disease, Act in Time to Heart Attack Signs, Get Energized, Say Yes to Physical Activity, Help Your Heart, Control Your High Blood Pressure, Be Heart Smart, Keep Your Cholesterol in Check, Embrace Your Health, Aim for a Healthy Weight, Protect Your Heart, Take Good Care of Your Diabetes for Life, Make Heart Healthy Eating an Everyday Family Reunion, Eat in a heart-healthy way, even when time or money is tight. Take control of your health. Enjoy living smoke-free. There are accompanying handouts and picture cards for each session to be used when you are teaching these sessions to other community health workers or clients. Handouts are available at the end of each chapter of your manual. Electronic copies are available by clicking your mouse on each handout title. Hello, and welcome to the peer-to-peer training of community health workers to improve heart health project. We will continue with session 2, Act in Time to Heart Attack Signs. By the end of this session, you should know what a heart attack is, why it is important to seek treatment quickly if a heart attack happens, the warning signs of a heart attack, why people delay in seeking help for a heart attack, the benefits of calling emergency medical services 911, and finally, how to plan ahead. When you are teaching this session, you'll be referring to 5 handouts located at the end of session 2 in your manual. Learn what a heart attack feels like on page 44. Fast Action Saves Lives on page 45. Fast Action Saves Lives Role Play on page 46 through 48. My Emergency Card on page 49. And Tender Care for a Happy Heart on page 50. Electronic copies of handouts are available by clicking your mouse on each handout title in the sidebar located on this page. Let us begin with a little background about heart attacks in the United States. About 1.2 million people in the U.S. have a heart attack every year. About half of those people die from their heart attack. Half of those people who die from a heart attack die before they reach the hospital. 65,000 African American men and 60,000 African American women suffer from a heart attack every year. Now please watch the video, Act in Time. Use picture card 2.1 to describe what a heart attack is. A heart attack occurs when the blood supply going to a portion of the heart is blocked in one or more of the coronary arteries. Remember that arteries carry oxygenated blood and nutrients to all parts of the body, including the heart. The top picture shows how a normal artery should look, and the bottom is an example of a clogged artery. A heart attack can happen because of heart disease. Heart disease does not develop overnight. It happens gradually over time. Fatty deposits build up on the inside of the coronary arteries. When this happens, the arteries become too narrow or create a blockage called a clot. When this blockage occurs, not enough blood, oxygen, and nutrients get through to meet the needs of the heart. If the blockage continues, a part of the heart muscle will start to die. When a heart attack occurs, medical treatment can restore the blood flow to the heart. Treatment works best when given as soon as possible, within 1 hour after signs of a heart attack. When a part of the heart muscle dies, nothing can be done to restore it. It is important to seek treatment for a heart attack quickly. Clot-busting medicines and other artery-opening treatments can break up the clots that caused a heart attack and restore blood flow to the heart. Angioplasty is a procedure where a balloon is inserted into the coronary artery through an incision in the arm or leg. The balloon is inflated to open the artery and restore blood flow to the heart. Sometimes, once the balloon opens the artery, a small mesh tube called a stent is inserted into the artery to ensure it remains open. This is an example of a balloon angioplasty. Above is the balloon being placed in the artery, and then the balloon is being replaced by a stent. Take a look at picture card 2.3 and the Learn What the Heart Attack Feels Like handout. These list all the warning signs most often reported by both men and women who experienced a heart attack. Discomfort in the center of the chest that lasts more than a few minutes. Discomfort in one or both arms of the back of the neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Cold sweat, feeling lightheaded, nausea, or feeling sick to their stomachs. The most common warning signs of a heart attack for men and women is chest pain or discomfort, but other warning signs may occur to other people. Many people think that all heart attacks happen like they might see on TV or in the movies, sudden and deadly. The reality is, not all heart attacks happen this way. Many heart attacks start slowly, with signs coming and going or increasingly getting worse. People can confuse the warning signs of a heart attack with the symptoms of other diseases like asthma, a pulled muscle, indigestion, or even the flu. When a person is having a heart attack, delay can be deadly. People often wait too long before seeking medical attention for the warning signs of a heart attack. Some people wait 2 to 4 hours, or even a day or more, to seek treatment. If you believe you're having a heart attack, the first thing that needs to be done is to call 911, preferably in 5 minutes or less. If you or someone else is unable to call 911, have someone drive you to the nearest hospital. You should not drive. Emergency medical services, or EMS, can sometimes have a bad reputation in some communities. But EMS plays a very important role in bringing the hospital emergency services to your door. Not only can they arrive quickly, but they can start treatment right away. They also carry along with them life-saving treatments and medications like oxygen, heart medicine, pain relief medicine, aspirin, or other medication that can help ease the pain of the heart attack. The EMS can inform the hospital of heart attack patient status, speeding up their receipt of treatment once at the hospital. They can also bring a patient to the hospital faster and safer than if someone drove them there. A person who is at risk of a heart attack should plan ahead. They should have a plan of action in the case of emergency and discuss the plan with his or her family. Planning ahead also means a person at risk of a heart attack should discuss how to lower the risk with his or her doctor. Persons at risk of a heart attack should have an emergency action plan, including an emergency card. They should complete the My Emergency Card handout on page 49 to have available in case of an emergency. An emergency card has the following information: name, relationship, and telephone number of an emergency contact person, emergency number for your area, your health condition, current medications, known allergies, and other important information. Now that you have completed this session, do you have any questions? Is there any information that is unclear to you or difficult to understand? What information covered in this session do you think community members may have difficulty understanding? Are there any issues particular to women that should be highlighted in this session? What information covered in this session do you think may be a little challenging for you to present? Why? You will have an opportunity to share your responses with other community health workers in your Learning Circle discussion and on the online discussion forum.